So my talk was about how patients with neurological symptoms present to the physician. So they have numbness, tingling, burning sensation in the feet. It's a length-dependent neuropathy and amyloidosis, so these symptoms progress without treatment, and then as they progress, they may at some point affect the fingers and the hands. A lot of time people have dysautonomia, so they have GI symptoms, diarrhea, constipation. They feel lightheaded when they stand up. If it's severe enough, they may faint. They may feel full early. They may have nausea and vomiting, and then they may lose weight as well. So we have different techniques to assess for neuropathy. Obviously, we have the neurological examination where we check the reflexes, the sensation, the motor strengths. We summarize that with a neuropathy impairment score, and we use that as an outcome actually in clinical trial. And this is how a lot of the treatment that we use today were approved. And we did modify them by using the modified neuropathy impairment score +7 by adding nerve conduction study, autonomic testing, quantitative sensory testing. So this is what we do. I try to introduce that in a simple way for non-neurologists, for our cardiology colleagues, for our hematology colleagues, so they can kind of understand what we do in the clinic. I did show a few videos of how we test patients, etc. I also talked a little bit about biomarkers, transthyretin, that we sometimes measure because the drugs that we use either decrease or increase these markers. I also talked about neurofilament light chain, which is getting a lot of attention. It's a marker of nerve damage, and we can sometimes use it as a biomarker. There's a lot of interest in using it as a marker of disease onset in people who are carrier of the gene but don't have symptoms yet. And the idea is that could we just track this over time and see even before the symptoms start, if this can give us an indication that the disease is about to start. And this is still a question mark, but this is an area of research for us.